Healthcare facilities under the Rural and Urban Private Hospitals Association of Kenya and Kenya Association of Private Hospitals suspended Social Health Authority and the Medical Administration Kenya Limited services in February 2025. The suspension, they said, was due to unpaid bills and an unsustainable reimbursement model. Here, we dissect the pending bills, how they came about, and what steps have been taken to resolve the situation. The government owed hospitals about 30 billion shillings in arrears from the now defunct National Health Insurance Fund (NHIF). According to SHA, out of the 30 billion shillings, almost 9 billion shillings has been settled between July and mid-October 2024.
The same report says that there is something like 2.7 million claims which have not been worked on. They are at various stages of approval. Providers had already submitted them. They were going through the system before they reach the final stage where they become money. The median value for an NHIF claim was 18,000. This is about 2 or 3 years ago. So on average, NHIF was paying about 18,000 per claim. Now, if you even assume that, let's bring it down and say it's 15,000 per claim, okay? The average claim. 2.7 million claims is worth 40 billion.
According to the chairman of SHA, Dr. Abdi Mohammed, the pending claims were historical, dating back 9 years ago.
That money is around 10 billion. Out of the remaining 30, we have settled almost 9 billion since around July to October, mid-October last year. So what we have was around 10 billion. But something usually happens, when we have those things, facilities are used to submitting claims. So what is happening currently is a process of reconciliation with the individual providers. Because, you don't want this general people saying, oh, there is this much. Rather than doing that, we have gone to each facility, and that process is 60% complete, to have a reconciliation process to see what claims have been submitted, what has been paid under NHIF, or what has not been paid.
Due to the pending bills, the associations also spoke of financial distress, stating that hospitals had lost staff, defaulted on loans, and faced medicine shortages, challenges that endangered patient care and hospital sustainability.
Our friends at SHA and at Ministry of Health, they just don't want to tell us how they are going to pay hospitals. They don't want to tell us. Now, so hospitals are there and saying, I can't make any more investments in this primary health because I don't know. It's uncertain.
The government, in a statement published online, promised to pay all hospitals with NHIF claims below 10 million shillings. However, hospitals with claims above 10 million shillings will undergo a verification exercise that should be completed within 90 days. 9,000 health facilities are contracted under SHA. Out of these 9,000 facilities, 334 are under the Kenya Association of Private Hospitals, 650 facilities are under the Rural and Urban Private Hospitals Association of Kenya, while 1,300 facilities are under Christian Health Association of Kenya. Claims that have been submitted under the Social Health Authority have been paid to a tune of 18.2 billion shillings from its rollout in October 2024 to February 2025.
We have, for example, the Alma Ata declaration where we committed to spend up to 15% of GDP on healthcare. We are barely doing 4-point-something% on GDP. Of GDP on healthcare. So healthcare is grossly underfunded.
Despite the suspension of SHA services by private hospitals, guidelines were put in place for hospitals to continue offering emergency services and to honor existing SHA-funded inpatient admissions and scheduled outpatient appointments. Nuru Abdulaziz for WeLaw Explainer.